Welcome back to the Means Report. Thanks again to Dr. John Morgan for sharing his expertise about movement and memory disorders. We really appreciate him, and we really appreciate Dr. Dale Peoples. He and Dr. Morgan might be in competition for most frequent Means Report guests because y'all are so helpful. Dr. Peoples, child psychiatrist at Wellstar MCG. Thanks for taking the time to be with me.
Absolutely. Always great to be here.
All right, let's just start. I wasn't going to start with this, but help me make the distinction between child psychologist and child psychiatrist.
Absolutely. No, it's a great question. We do have a lot of overlap in what we do. We're both concerned with children's mental health, doing everything we can to help out there. Both of us engage in therapy and counseling. When it gets to the differences, what might separate one from the other, the psychiatrist can also help out with medication. So if it's looking like a problem's getting to the point where you're considering a medicine to help out, you're going to want to speak with a psychiatrist. Psychologist, their real specialty is when it comes to testing. So, say you've got a kid who's really struggling academically, you want to rule out a learning disability, something like that. You're going to need to talk with a psychologist to administer that psychological testing.
Okay, that's extremely helpful, and I think it's probably helpful to a lot of you all out there as well. Thank you for that. Mm-hmm. General question, we could probably spend the whole segment with this answer alone, but Dr. Peoples, what's stressing our children these days? What's bothering our children? What do you see in your office?
Yeah, so, I would say that anxiety has been on the rise and increase, and I think we're still looking at a little bit of a ripple effect from COVID. Life's returned to normal in many ways, but we had a lot of kids that really were thrown for a loop academically and are still kind of struggling to make up that difference, which increases the anxiety related to school. And then you've got just kind of the lack of social contact for a couple years there, which has made some of those social interactions and connections a little bit more challenging for our kids.
Have you found in most cases schools, and if you can't answer this, feel free to tell me, but my question is, are schools willing to give these kids a little bit of a break, give them some accommodations or leeway so that they can readjust post-COVID?
Yeah, I think schools have done what they can to be supportive and try to get kids back on track. But every kid is going to be a little bit different, and what works for the majority of kids might not serve every kid. So sometimes schools have to get a specialized plan, what might be referred to as a 504 plan or an IEP, an individual educational plan, to really kind of get a kid back to where they need to be.
I ran into a guidance counselor the other day at an elementary school who told me that some of the younger children, the babies, the kindergartners, were having difficulty because these are 4-year-olds, in some cases 5, and if you do the math, that's start of the pandemic 4 years ago up until almost now this very day. And my question is, are those children too little to come see you? Or have you heard of this where they cannot handle school right away because this is the first time they've been out of their home pretty much in 4 years? They're not great with social skills because they've just been with mom and dad from the pandemic onward. Has that come across your radar?
Yeah, that age developmentally, it is a time where you're going to see a little blip with anxiety. So just, because you are getting out of the house, entering a new domain with school, it's normal for a lot of kids to struggle, but I think you're absolutely right that, we are seeing that the situation's been a little bit worse because these kids did spend some of those formative years in the pandemic. On top of that too, even before the pandemic, we were seeing a little bit of an increase in issues with social skills and with anxiety in the younger kids. And then I think you're kind of looking at bigger social trends like, smartphones kind of becoming a barrier between communication between parents and kids. So kids aren't having quite as much interaction at home as they used to. And, of course, family size is also shrinking. So, you're seeing it's more and more common that you're going to have one-kid households where kids might not have as much opportunity to kind of bounce off each other and interact. So then you come to school for the first time.
Right.
And it makes it a little bit more challenging.
All right, so let's look at a two-pronged way to potentially address those issues. Number one, should we have phoneless periods built into our family schedule? And number two, should we make sure that there are play dates or other social opportunities so we avoid those problems you mentioned?
I'd say yes to both.
Yeah.
On the phone-related issue, of course, it's going to change, as a child grows and matures, and you're going to get more independence and more decision-making as you demonstrate responsibility. With those younger kids, the more that we can kind of keep them off the phone, probably the better off they're going to be. And when you are engaging in a screen activity, it's best if the parent engages in it with the child. So it's a collaborative thing, you talk about it together, and that's going to help the kid with the social skills, even if they are watching something on YouTube or whatnot. With the other question
Like
was...
a forced play date, not forced, but a play date,
Right.
so that by the time they do get to school, they know what it's like to be around kids.
There's a good bit of research that actually shows that unstructured play activity does improve social skills with kids. Having that time outside of the house, interacting with other kids, if parents are able to make that happen for them, it is going to help the kids socially.
Man, we ran the streets when I was coming up. I mean, we would, if you're home before 10, you're good. But yeah, times have certainly changed. Hey, should we check our children's phones? Ask what the password is, and when they're in the tub or something like that, kind of scroll through it?
Yeah. So when I'm talking to parents and we're kind of thinking ahead, the problem hasn't already developed. Yes, good oversight is essential. So, when the electronics are getting introduced, really the parent having control, knowing all the passwords, keeping an eye on things is critical. Now, again, kid gets older, demonstrates more maturity, more responsibility. Obviously, the parent's going to back off a little bit. I'm not going to check, but we're still going to kind of follow each other on social media, so I can get a general sense of what's going on. If I've got a big worry, you're agreeable to let me looking at the phone if, again, there's something that demonstrates concern.
Okay, that's really good advice. Real quickly, yes or no, is there an appropriate age for a child to get his or her first phone, or does it vary by child?
It's going to vary by child.
Okay.
I would say, most social media, the recommendations are you don't really want to get involved before the age of 13. Every family is going to be a little bit different, and you might think about limiting access to particular apps, and making sure you've got good parental monitoring software on the phone if you're going to introduce the cell phone at a younger age.
Dr. Peoples, is anxiety easy to treat?
It's very responsive to treatment, and there's a lot of things families can do on their own. Anxiety really responds well to talk and behavioral therapies too. So a lot of times you're not really thinking about necessarily needing medication to manage anxiety. So yes.
So from the time a person who's watching, who might think right now, man, he's talking to me, he's speaking to my family. From the time they bring their child to you for help, how long until you can get them to manage things and go back out in the world without having doctor's visits?
Yeah, it's going to vary a little bit on the degree of the anxiety issue. Again, sometimes families can really manage this themselves by, identifying the situation that's causing the anxiety, setting up little challenges to kind of build out the kid's comfort zone, and that's going to gradually reduce the anxiety itself. If you're talking about behavioral therapy intervention for anxiety, a lot could be accomplished between 6 and 12 visits.
Okay.
Again, there's going to be a lot of variance depending on the individual and the problem at hand, but anxiety is very responsive to treatment.
Do you see ADHD, or is that more the psychologist's realm?
As psychiatrists, we do a ton of ADHD management because a lot of times medication is going to be part of that.
Dr. Peoples, is this new, like in the past 20 years or so? I don't remember ADHD when I was a child. Is this a new diagnosis?
Well, in medicine, we do always change the names of diagnoses every 10 or 15 years.
My goodness, what was it called back in the day?
Okay, so we had ADHD, and then you had ADD, attention deficit disorder. Before that, it gets interesting. It was minimal brain dysfunction.
Whoa, minimal brain dysfunction.
Because your brain was pretty much functioning well. It's just a little problem with it.
Okay, no, ADHD, much better.
Yeah.
much easier on the ears. Well, I appreciate that so much. For 15 seconds, can we do anything diet and exercise to help our mental health?
100%, that is super helpful. Making sure you're getting good sleep is crucial to good mental health. Exercise does a lot to reduce anxiety and improve mood. And diet is just going to help with overall health and wellness, yes.
Listen, I cannot thank you enough. You are always so great, and I appreciate the information that you've imparted today.
Well, thank you. It's great to be here.
Absolutely. Dr. Dale Peoples, psychiatrist at Wellstar MCG. When we come back, how you can help shape future editions of the Means Report. Stay with us.